This is the sound of refusing to give in. It's leaving nothing to chance. Searching relentlessly for the right, the only treatment option that will keep a heart beating. Fortunately, the Christ Hospital Health Network has groundbreaking treatment options unavailable anywhere else in the country, developed with help from our own physicians. That's what makes us Greater Cincinnati's Heart Hospital and one of the top heart hospitals in the world. The Christ Hospital Health Network, everything it takes.
The Pound This podcast is brought to you by the Christ Hospital Health Network. This is the Pound This podcast, episode 800, PCOS Q&A with Dr. Lindsay Wardle.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This podcast with Amanda Valentine.
Hello, friends. Welcome to the Pound This podcast. Before I get into this conversation all about PCOS with Dr. Wardle, I want to tell you about Clean Eats. I've been using Clean Eats for the past several months for meal prepping, and it has been amazing. I've been meal prepping for almost a decade, and it is way nicer when somebody else does it for you. I mean, it's so hard to eat healthy in the first place. It's because, living a healthy lifestyle, obviously nutrition is a big part of it. And we discuss in this podcast with Dr. Wardle about dealing with women's health and hormones and everything like that. It is also, how you move your body and how you eat. And it's really easy to not eat great. And so whenever you have more convenient choices that are also delicious, that also are made with fresh foods, it is insanely helpful, which is why I love Clean Eats so much. I go to Clean Eats in Newport, Kentucky, here in the Cincinnati area. There's also the Westchester location. What's great is for me, I order 21 meals a week. You don't have to order that many. You can choose whatever is best for you. And I ordered them. I choose what I want. And then I have the option of doing higher protein. I have the option of doing lower carb. And then I pick them up, all the meals done, throw them in the fridge. Fantastic. I got food for the week. You can also go in and choose from their freezer section, and you can do the grab and go. And there's a lot of choices there. They also have amazing pizzas, and then they have the protein bites. The Buckeyes are awesome. You can go in there and they have supplements available to buy. I saw somebody message me on Instagram and they're like, oh my gosh, they have First Form. That's awesome. So if you're looking for healthier options and make it easy and convenient, check out Clean Eats in Newport or Westchester. Right now, let's talk to Dr. Wardle. Thank you so much for listening to the Pound This podcast. I am Amanda Valentine, very excited to chat all about women's health and PCOS, which I feel like is such a hot topic, with Dr. Lindsay Wardle I feel like I messed your name up already. Dr. Lindsay Wardle from the Christ Hospital Health Network. How are you?
I'm doing well, thank you. How are you?
I'm great. So tell me about all of your background, what you do at Christ Hospital, what got you interested in this field of medicine, et cetera.
Yeah, so I've been with the Christ Hospital Liberty in Springboro for about 6 months now. I trained as an osteopath at Ohio University, and then I did my residency in Dayton at Southview Hospital, and then I practiced with the Kettering Health Network for about 7 years, and then I decided I really liked the model at Liberty and joined one of my previous partners, Dina Costa, down there. And I got into OB really because I feel like I've always been passionate about women's health and women taking care of women. And I truly love delivering babies. I love surgery. I love talking to women about their health. So it was just the right field for me from the beginning.
So if there's somebody is like looking for a new gynecologist and they listen to this and they really connect with you, they could find you at Liberty Township or the Springboro Women's Health office, and you can just, are you accepting new patients, I guess is the question.
Absolutely.
Okay, awesome.
Yeah. So we're always accepting new patients, and in Springboro, oftentimes we could get you in within a day or two.
Oh, that's awesome. Yeah, I think having the correct gynecologist is as a woman, I feel like it is a big deal. And I know there's a lot of preferences, myself included. I just personally feel more comfortable with a woman gynecologist than a male gynecologist, and nothing against the men, but it's just like, that's a personal preference. And And I know that many women feel the same sort of way and want to, it's such an intimate doctor's visit. You want to have somebody that you really connect with and feel comfortable with, because if you're not feeling comfortable in that visit, I feel like there's a lot of opportunities for trauma.
Trauma, and even, not wanting to have an honest conversation about what's really going on with your health.
Yeah, I feel like that's so scary that I feel like so many people, and I feel like instances for me in the past of, that's the last person you should have fear with, of asking questions about your health. Because if you can't talk to your doctor about it, who are you going to talk to about it?
Exactly.
So I know it's such a huge topic, at least in my world, of kind of like health and fitness, especially of having so many discussions and being on my own weight loss journey. Of PCOS keeps coming up. I mean, we're going to get to the questions because I did have listeners ask questions that they wanted to know about PCOS, but I know the term PCOS came into my world because I knew that women that were dealing with it were having a lot of struggles with like nutrition and weight loss. So that's kind of my introduction into that world. But I guess for anybody else that's like, I've heard the letters PCOS. What does that mean? Like, what's going on with that?
Yeah. So polycystic ovarian syndrome, really, there's a lot of different presentations for it, honestly. Some women come in complaining of having irregular periods. Other women are having no periods at all. And then some women, they're struggling with infertility, struggling to lose weight. They have excess hair. So those are the most common presentations. But, as an OBGYN, what I'm looking for, I'm looking at signs of high testosterone or hyperandrogenism. So, I've got a lot of facial hair. I've got a lot of hair on my body that seems kind of refractory to treatments. And then truly I'm looking at ovulatory dysfunction, or people who are having irregular periods, no periods, heavy periods. And then kind of going from there to look at what possible diagnoses we could have, PCOS being one of them.
So how common is PCOS for women?
It's estimated in about 7% of all women that are of childbearing age.
Okay. Now, is that something that you could self-diagnose, or is that something that you definitely need to see your doctor and run some tests on to make sure that's exactly what's going on?
It's a clinical diagnosis. That's to get an actual diagnosis, you should see a physician, but a lot of women have suspicion before they even come in.
Okay. So that's what the process you would kind of go through, is just look at all of the symptoms and just kind of decipher what's going on and if PCOS is one of those things?
Yeah.
Okay.
So, seeing a physician, kind of giving your symptoms, saying, even if you're suspicious, saying, yeah, definitely, I'm thinking about this. That kind of starts the whole process.
Now, does PCOS mimic any sort of other issues that could be going on that can get confused with?
So there are a couple other things. You can have high levels of prolactin in your body that can be causing irregular periods. You could have some issues with your thyroid. There's some types of adrenal hyperplasia that could kind of mimic the same type of symptoms and signs. So that's why we start the workup and make sure that truly is the diagnosis of PCOS.
Now, can this be affected at all, or I guess, I can't think of the word for it, but yeah, I guess affected at all by any sort of birth control? Could that trigger anything with all of this?
No, PCOS usually presents kind of as its own entity. Birth control actually helps women with PCOS, believe it or not. So, some women, they'll be on birth control for years because they start it for contraception or they start it for irregular periods. And then, they could go off of it years later trying to conceive. And that's when the true diagnosis can come out of PCOS.
Okay. So other than having like you said the hair of irregular periods, like, is there any other symptoms that would be kind of standing out, like any sort of like pain or appetite change or anything like that?
Not really. Some women or a lot of women with PCOS have high insulin levels and they struggle to lose weight and things like that. So it's kind of the combination, the cluster of the symptoms that drives people to present, to talk about it.
Yeah, let's definitely dive into that, since that's, I feel like the number one thing in my world I hear about is the weight loss from PCOS and how that's such a struggle. So what's happening there that is causing that to be such an issue?
So high insulin levels can lead to your body not utilizing glucose properly. And so a lot of those women struggle to lose weight. They struggle to be on a diet because, they're hungry truly. So, definitely presenting to your physician and talking about this can kind of help, because we can guide you. There's no specific diet that helps with PCOS. At least that's what the studies say. I talk to my patients about something that's sustainable for them. So, whether it's Weight Watchers for you, or whether it's keto, or whether it's just low carb in general, or just cutting calories and exercising. Overall, our ACOG is kind of our governing body for OBGYNs. And they recommend ultimately restricting your calories and exercise as the main goal. But again, like I said, finding something sustainable that can work for you is ultimately going to help you longer term. Some of the newer studies show that women who undergo like gastric bypass or something like that, that can help with ultimately keeping weight off and getting it off, and can improve infertility rates and things like that.
So does PCOS cause any weight gain?
It can. It's kind of like chicken or the egg, you know what I mean? So a lot of women who have PCOS struggle, but up to 20% of women with PCOS don't carry any excess weight, their normal weight.
Yeah, it just feels like that's such a struggle for so many people of trying to manage that. But it's good to hear that, because it just kind of feels like that's just like general, like good life advice of like, do what's best for you. And just like, I feel like that so many of us just don't want to feel our own bodies. And it's hard to like really kind of tune in and pay attention to that. I mean, myself included, I will fully admit that I've blown through many yellow lights, and my body has paid the price for that. But I feel like it's one of those things, and you can tell me if I'm out of line here, that it's like if you're eating a certain way or whatever, and you're like listening to your body and feeling how it's reacting to those things, then that's time to like cut that out or to shift something differently. And I think that if you're paying attention and feeling good in your body, instead of being like, oh, well, I need to lose weight, so I have to do this, and like try to cram that, square peg into a round hole, that's just going to, I feel like, stress you out and make your symptoms even worse.
Absolutely. A lot of women with diets, they go on these crash diets to lose weight. And, in the process, their body is like, whoa, this is not working for me, whether, it's belly upset, et cetera. I think just finding something that, you can sustain over many years that is healthy is most important.
I mean, how often does that topic come up for you, being an OBGYN, of just women and discussing, I guess, just like body size or issues around, gaining weight, losing weight? I imagine that has to be pretty commonplace for you.
Multiple times every day.
I mean, isn't it just like it's so hard to just even like, I think on a topic like this, and tell me if I'm wrong, I'm just speaking on my own terms here, of like, we're talking about something like our health and trying to take care of, our hormonal health, or, our women's health, but then we kind of get like clouded with like, well, I have to fit in this certain size jean, gets like tangled in the middle of this, like, well, just take good care of your body, and maybe let's chill on having to lose weight, unless that's like necessary for your joint health and for you to feel good. It feels like we kind of like crush past the like, oh, the healthy thing to do versus the more I guess, vanity choice thing to do. And I will 100% say I'm guilty of that. And
I think all women are at some point in their life.
Right.
There's definitely a healthy weight number. Obviously obesity or being overweight is not ideal. But for a lot of women, they're focused on that size 6 or size 8 or whatever it is. But really just feeling good in your body and feeling confident. And, I think that exercise can help a lot of women with that. Diet really is key too, in terms of overall sustaining a healthy weight. But, I think that exercise can provide women with a lot of opportunity, to feel good about themselves, to feel good in their body, and to, maintain their bone health. There's a ton of benefits for that as we get older too.
Totally. And just to throw this in there too, like I've done other podcasts and stuff with people that like research this sort of thing of like the ideal amount of exercise to get in a week. And really it's any sort of movement at all, like getting out and walking. It doesn't have to be this go out and crush it sort of thing. So
Right.
it's I think that so many of us, myself included, that is this very all or nothing sort of thing of like, I either am working out 5 days a week or I'm doing 0. So I think that just even putting taking some small steps in moving your body, I'm sure you've
Those small
seen
steps lead to bigger steps.
yeah. And I'm sure you've just seen like the difference in the women in your office that are making those sort of like choices and how that affects them.
Absolutely. Yeah. And exercise can help with stress levels and, feeling depressed and all these things.
So I did have somebody ask the question, what are the right questions to ask your doctor? I mean, is that even like, is it just the right question just to be like what you're feeling?
In terms of PCOS or just in general?
Let's say both.
The right question to ask your doctor, most women don't keep track of their periods. I think that that's really important. It's kind of a guide of if our body is healthy or not. So definitely start keeping track of your periods. And if you're noticing, I'm going 45 days without a period, I'm going 60 days without a period. What could be going on with that? And then in general, asking the questions to understand, a lot of doctors can have doctor speak, so to speak. And if you don't understand it, like that could affect long-term progress. So, I'm really big in people being an advocate for their own health and understanding what I'm saying to them. And, I try to use simple terms so that people understand it, but don't be afraid to just keep asking questions till you understand.
So this is unrelated to PCOS, but since we're just talking about tracking your periods, I had a question. So I use an app because otherwise I won't remember, which seems weird. It feels like that's something you would, but I just don't. But I did have I'm fairly regular. I have an IUD. And so I feel like I'm pretty normal, I guess, in having my cycle. And I guess a couple months ago, I was like late, like 2 weeks. And I'm like, what is this? And all of a sudden it just started again. Now I'm like on a new cycle. Like, so what is your body doing when all of a sudden it's like, you know what, we're going to e-brake this for a minute and we're going to like restart you on a whole new thing.
Yeah. So that can happen to women. Definitely different things that are going on in your life, travel, stress, etc. As we get older, sometimes people's cycles can lengthen or they can get shorter. So, you could be a 28-day person for years, and then suddenly now you're a 24-day cycle person. So that's why, tracking your period can be helpful. Even though IUDs are extremely effective, there's always a risk of pregnancy. So, you need to be aware, like, hey, I haven't had a period in a long time. Like if you're someone who is regular, keeping track of that is very important. And myself, I use an app as well.
Yeah, it just feels like, there's just so many things to keep track of, just living in my own body that I feel like I that's where I think it's fascinating and scary at the same time of how much I don't know about my own body. Like if you sent me a picture of all my parts, I wouldn't be able to tell you what like everything inside of me is or outside. I feel like there's just so much of why don't I know more about this? Why don't I know more about my cycle? I've been learning a little bit more about how they're talking about just even from exercising, how to exercise according to your cycle of like certain days you have more energy and certain days you should have more rest. And I'm like, why don't I know about all of this stuff? I've been a woman for 40 years. I feel like I should know more, but it's just like, I can't be alone in that. I feel like there's gotta be women in your office that are also just like, I don't even understand how my own body is like working or why it does what it does or what's happening.
Yeah. That's why I feel very passionate about educating adolescents. I've participated in some programs that have helped teach young girls about their cycle and about their body parts that they need to be aware of and things like that. So, when women come into the office, I do my best to educate them and make sure that they understand what's happening and why it's happening. But yeah, learning more about your body is never a bad thing.
Right. So what would you say is probably the most common issue that comes up for you on a daily basis? Is it things like PCOS or any sort of like hormonal questions?
There's constant hormonal questions. It's kind of a buzz topic right now, so to speak. We definitely get a lot of questions about that and menopause. PCOS comes up pretty frequently. Those are probably the top few.
Okay. Another question. I know this isn't PCOS related, but like, what's the difference between perimenopause and menopause?
So perimenopause is the time period, where cycles may change. You may start to space out your cycles. You may start to have really heavy bleeding, but these are the years leading up to menopause. Okay. Women become more symptomatic. They may start having occasional hot flashes. And then menopause is truly 1 year from your last menstrual period. Then you're postmenopausal. So gotcha. Menopause is the cessation of your period, essentially.
Okay. Because I feel like that's, I'm 40. So I know I'm going to guess maybe you're the expert here, like a decade or so until whatever my body decides from that. And that's where I'm like, oh man, well, this is going to be a thing that I have to start paying attention to also. Right. Instead of just like tracking my periods of like, I guess just like, when am I going to start getting signs of that's happening? And like, wow, this is just one fun thing to the next one.
Average age of menopause is about 51 years old. Okay. So some people are symptomatic for years beforehand. Oh. Other people, they just stop their period and never experience any signs or symptoms.
Well, fingers crossed for that one.
Right. I want the easy way, please.
Right.
Yeah. But perimenopause can start many years before menopause. But, I've had women as young as 38 experience perimenopause and stop menstruating in their early 40s, but the vast majority of women are going to continue to have periods through their 40s and then go through menopause sometime in their early 50s.
Fun. Can't wait. Well, so obviously there's a lot of questions to ask about, outside of like PCOS and everything else that we discussed. So if somebody does feel like, oh man, I have more that I want to ask about, there's more questions that I have, is there a way to reach out to you? Is it best to just schedule an appointment with you? What's the best avenue to take?
Yeah, either the Liberty or the Springboro office would be great to reach out to. If you're a patient of the Christ Hospital Network, easily probably find us on my chart to request an appointment. I know they have online appointments available. But like I said, again, we're very wide open at Springboro, and we would love to have you.
Dr. Wardle, thank you so much for your time.
AmandaValentineBites.com